what really is menopause in the simplest terms as possible?
Menopause is basically stopping your menses. So for it to be a clinical definition, a woman has to cease menses for 12 months and more. Okay. So when a woman is not attending or having their menses,
good evening, wherever you are watching us from the Diamond TV online and also on TV. It's amazing to be back here where we come every Tuesday, 17 to 18 hours. This is the most lovable and enjoyable health talks that you always have with us as Teledoctor. I am Malango Goma. I'm your host for today. And today we have a very wonderful topic. Okay, so in this month of May, we were commemorating and celebrating mothers out there. We talked about a lot of things that affect women. So today we bring to you a topic called menopause. So what is menopause? Today we'll be discussing what menopause is, at what age it sets in. Most of the time people always talk about, no, the biological clock is ticking, you cannot have a child after this and that. So today we're about to settle those myths and misconceptions. I have a well-esteemed gynecologist and obstetrician in the building with me today, and I'll introduce to him after this short break. Stay tuned. All right, so before the break, I told you the topic that we have today is menopause, and I have a very wonderful guest today who is an obstetrician and gynecologist. Help me welcome Dr. Andrew Musoni. Dr. Andrew Musoni, how are you?
I'm okay, thank you.
Welcome to the show.
I appreciate it, thank you.
All right, so I know because I've introduced who Dr. Andrew is, but kindly tell us, who are you and what do you really do?
All right, like you have mentioned, I'm a doctor specialized in obstetrics and gynecologists, and I'm currently based at Zimba Mission Hospital in Southern Province. Okay. Some of the things I like to do in my spare time is to read books, watch movies, and just update myself with the current events, what is happening around the world.
Wow, yes. I love the fact that you've talked about what is currently happening in the world and all that. Current affairs. So I love we're on the same page because we're talking women this month.
Yes.
Yeah. In your work experience as a male doctor, what challenges have you experienced with females who don't like being attended to by male doctors or just male health practitioners?
I think recently the response in terms of women attending to who we attend to is better than it was before. Okay. We do have, though, a few women who specifically want to be attended to by a female doctor, which is all right, but they're right, and we usually want to give them that opportunity to be attended to by who they want to be attended to. So I think for now, I think recently it's better most than it was in the past. So we're doing much better in terms of attending to women now.
Oh, I love that. Yes. Yeah. Anyway, there are some people who testify saying actually being attended to by a male practitioner, especially when you come to the labor ward, most people prefer being attended to by the males. They always say, no, they're empathetic compared to the women. So I'm loving that ice is broken and everyone can have a feel of what it feels to be attended to by anyone.
Yes, indeed.
So now we come back to the topic that we're talking about today, menopause.
Yes.
Yeah. So what really is menopause in the simplest terms as possible?
So generally to speak, menopause is basically described as stopping your menses. So for it to be a clinical definition, a woman has to cease menses for 12 months and more. Okay. So when a woman is not attending or having their menses for 12 months and more, then we can say that they're now in menopause.
Okay.
Yes.
I love that I'm now learning because there are some people who have irregular periods. Yes. And then maybe I'll go like for 3 months without having the periods and I'll say I'm in menopause age.
No, unfortunately the definition of menopause itself, someone has to not have menses for more than 12 months. That's when we would say this woman has got menopause now.
Okay.
Yes.
And does it have a specific age for attaining it, or?
Yes. So there's an average age. So there's an average age of 51 years for women worldwide. But for a range, it may range from 45 years to 59 years. So women can range depending on their genetics or other factors that come in. The range may extend from 45 years to as late as 59.
Oh, okay.
But on average, it's about 51 years.
Okay.
Yes, please.
Does before anything else, does also the time that someone attends menarche also contribute to when they can attain menopause? Like when they first have their menstrual period when they've just grown up, does it affect also when one is going to reach menopause?
Not necessarily. So like I mentioned, the time that they attend menarche may not really determine when they're going to have menopause. Some it may be still longer. For them it may still be early, regardless of whether you attended menarche early or your menarche was late.
Okay.
Yes.
So what causes this menopause?
Yes. So menopause generally it's a natural event that happens in women. So it's a natural transitioning from reproductive age to what we say menopause. So basically, it's when a woman's ovaries, so to say, stop producing follicles or what we call eggs. Yes, so with that, when the eggs or the follicles stop being produced, it means the menses also stop. So there are certain factors that come in with that happening. So when the cessation of follicles being produced, basically menopause would have been attained. Oh, okay. Yes.
And is it just for females, or do men also go through menopause?
That's an interesting question. So in the literal sense of menopause, we can't necessarily say there is something that men undergo. But in men, there is a certain state that we call andropause, or andropause meaning androgens basically have been paused. So it's similar but not necessarily the same as menopause. So basically in men, usually after the age of 40, they tend to have a decline in the production of testosterone. So with that comes with certain symptoms or signs that may be displayed after that age and may be attributed to that particular term, which we may call more like it's similar to menopause in a way.
In a way.
Yes.
Okay. And this is getting interesting, and I'm loving it. So when we hear men, it's for the females.
Yes.
Andro for the men. Okay. Wow. Yes. I didn't know, because I thought it's menopause. So learning is actually taking place. So now I wanted to find the commonest signs and symptoms apart from cessation of periods. How can one know that they are attaining this menopause?
Okay. So there are a number of symptoms or signs that are associated with cessation of menses or basically menopause. There's a bracket of symptoms. For example, the symptoms we call vasomotor symptoms. Generally, this woman presents with what we call hot flashes, which is one of the commonest presentation of menopause. So a woman will suddenly present with a sudden intense warmth that is associated with sweating afterwards. So this may last on average 1 to about 5 minutes. Okay. There are other symptoms that are associated with mood changes. So women may be depressed, may display anxiety. Other symptoms will be sleep disturbances. Part of the general or genital system, or what we call symptoms involving the urinary system or the genital system. There could be symptoms associated with increased frequency, so they'll be urinating more and more. They may have incontinence, where they they just find they have weighted on themselves. Okay. They may also present with what we call vaginal atrophy. So because of loss of the hormones due to cessation of menses, more specifically the hormone estrogen. So women will present with vaginal dryness, vaginal atrophy. So with that may come symptoms that, for example, when they are having sexual intercourse, that may be associated with some pain. With that could be associated with loss of libido later on. Yes, so so women will present with a variety of symptoms associated to cessation of menses.
Okay.
Yes, among others, yes.
Oh, wow. So having gone through our prominent signs and symptoms, wow, okay, women go through a lot, so I can say.
They do indeed, yes.
Yeah, I now wanted to find out, there's a common saying out there that the more children that you have, the earlier you're going to attain menopause. What's your comment about that?
Of course, there are a lot of things that we hear out there, but what it means basically is that when you're having more children, you're probably losing more follicles or eggs, so to say. But it still doesn't mean you attain menopause fast, because I don't think you can deplete all the hormones by the time you're reaching the age of 45 or 51 on average. So it may not be true, so to speak, because we've seen women who are having 12 children, but they still attain menopause at the age of 52, 50. So there's it's a normal average age of menopause. So it may not necessarily mean more children.
It goes fast menopause.
Attain early, not necessarily, no.
Wow. Okay. I'm really enjoying this talk. And viewers, if you've just tuned in, this is the Teledoctor Show, and we are live. There's a number that's displayed on the screen where you can call us if you have any questions for us. And we are talking about menopause today. So we'll be right back. We just want to take a short break, and then we'll continue with our talk. See you on the other side. Much for tuning in. This is the Teledoctor Show, and if you've just tuned in, this is a live and a phone-in program. The number is displayed on the screen, and today's topic, we're talking about menopause. Okay, and then there are some of you who want to reach us through the Teledoctor customer service line. The number is 0979 904 046, 0979 904 046. So earlier we talked about what menopause is, the prominent signs and symptoms that one can tell, and I've even learned that also men can sometimes go through a process known as menopause to the layman, but it's called andropause for the men, and this is a beautiful thing. So I have Dr. Andrew Musoni, an obstetrician and gynecologist, that is actually giving us this cardinal information. So Dr. Andrew, I wanted now to find out, does menopause require treatment?
Okay, so there's a certain percentage of women who do present with severe symptoms, the ones we've highlighted. So if these women have severe symptoms, they indeed have to be attended to and treated. Okay. So in terms of their treatment modalities, or the different types of treatment that is there, we have what we can call pharmacological, or something to do with medicines, or non-pharmacological things like lifestyle modifications. So there are certain lifestyle modifications we can encourage, such as exercises. We can encourage women to stop alcohol if they take alcohol, to stop smoking. In terms of diet, we can also encourage them to start taking vitamins like vitamin D, to include calcium in their diet, because one of the complications of menopause is that the women are at risk of having osteoporosis, where there's a reduction in what we call the bone density. So with that, they can easily have fractures, for example, what we call osteoporotic fractures.
Oh, wow.
So because of that, we want to encourage part of their diet should have vitamin D and calcium, as well as encouraging exercise so that we maintain the bones. So in terms of a pharmacological treatment, we can offer them what we call hormone replacement therapy. So basically, this is therapy that to help to relieve women of their severe symptoms or their symptoms, to help them be able to cope in their day-to-day activities. So like I mentioned, it's hormone replacement, meaning we're replacing the hormones that have stopped being produced now with the hormones that we can give them. Yes, so with that, there are different types of hormones, estrogen or progesterone or combined forms.
Oh, okay.
Yes.
Wow. You know, when we have some people saying, I'm going through this process of menopause, we always think, maybe they're just exaggerating. But having learned, I didn't know that there was even supposed to be some treatment to that. Is this menopause reversible? Like when one attains it, we can reverse it? Okay, so like I mentioned, it's a natural process that occurs. So it is something that is attained through natural process, unless otherwise. So because of that, it is a process that you can't reverse, so to speak. So it is a process that you won't reverse because it comes naturally as a woman is getting older. Depletion of those follicles or those eggs, it comes menopause. So it's a process that naturally can't be reversed. Oh. Yes. Okay. And I know we've talked about the pharmacological and non-pharmacological aspect, but emotional support.
Yes.
Family, workplace, and partners. How can they support women going through this menopause stage?
Okay, that's a very important question. So the women who are attaining menopause, these are women who really require a lot of support. Many people may not understand what a woman is going through because there are variations from women to women on what they're going through. So we encourage women to be open enough on what they're going through, either at home, at work, or with family. With that comes more help, emotional support. For example, we encourage partners to always understand what their women are going through. For example, the partner, a woman may complain that she's feeling pain, for example, during sexual intercourse. We encourage the partner to understand that, and there are forms of treatment also for what we call vaginal atrophy. That we can give estrogen creams or creams that will help with that process. So we encourage openness both at work, at home, or with family members. And like I said, they really require a lot of encouragement and support. So that has to be provided, because also part of the support is the psychological support that the women need. I remember I mentioned women will go through mood swings. They may be depressed. They might be anxious, so they also require psychological support. If need be, these psychologists, psychotherapy can actually be recommended if that is the major symptom that a patient is presenting with. Yes, so we encourage support.
Oh, wow.
Yes.
This is beautiful. And now I want to go back where you talked about one of the complications because of the bone density that reduces.
Yes.
And we get osteoporosis, right?
Yes.
Yeah. So what other complications do we have for menopause?
Okay. So like I mentioned, part of the complications will basically be some of the symptoms that they present with. So, but the major complications that we tend to look at, one of the major ones is, like I mentioned, the same osteoporosis, which may lead to osteoporotic fractures. With reduction or loss of estrogen support, they are at risk of cardiovascular events such as myocardial infarction. With loss of estrogen, like I mentioned earlier, there is vaginal atrophy. With vaginal atrophy, this may lead to what we call painful sex or dyspareunia. With that may lead to loss of libido. Of course, like I mentioned, these are women who are also at risk of mood swings. Mood swings may lead, some of the mood swings can either be anxiety, or they may actually just manifest with severe depression, right? So with that, they may need psychological support as well. So the a number of complications may vary, but I think these are some of the major complications that women will generally present with. Some of the other complications in the what we call the urogenital system, with loss of estrogen, there's also loss of what we call supporting structures. So they may easily have complications of what we call pelvic organ prolapse. So they may also be at risk of complications of what we call pelvic organ prolapse as well.
Okay.
Yes.
So what, in simple terms, the pelvic organ prolapse?
Okay, so basically is, so there are certain organs in the pelvis which are maintained structurally by the musculoskeletal supporting structures in the pelvis. For in simple terms, basically. So with estrogen, with loss of estrogen, they tend to weaken and not maintain their natural structure ability. So you find the bladder might collapse from the bladder wall, collapse into the vagina. The rectum may not be maintained in its position, may also prolapse into the vagina as well, or indeed the cervix may prolapse, or indeed the uterus. So those are some of the organs that can prolapse with a weakening in the structures. So basically that is part of the pelvic organ prolapse entity. Yes.
Okay, and I wanted to now find out, because there's some, myths and misconceptions which we are trying to put down today. We get the knowledge from you. There are people who say when you reach menopause, you are predisposed to having cancers. How authentic is that?
Okay. Okay, so menopause in itself is not a risk factor for any cancer. Okay. But because of the age, we know most women who are menopause tend to be in an advanced age. So it's more of age related than it is of menopause on its own. Okay. So with age related comes risk of cancers such as breast cancers, ovarian cancers, endometrial cancers. So those cancers really are more related to the age rather than to the menopause itself. Yes. Oh, wow. Yeah.
See, that's why I'm telling you that learning is taking place, because everyone will say, because, fluctuation, others will even convince themselves because of the hormones, but there's this fluctuation of hormones, and that's why there's cancer and all this.
So it could be other factors associated with someone getting cancer. There could be genetic factors, certain risks that are individualized from person to person, and not necessarily someone attaining menopause. Yes.
I love that. Okay. And I wanted to find out if we have any form of support looking at menopause today, and I'm sure everyone has learned something, because others will just take it lightly. It's when you cease menses, you can't conceive and all that. But having talked about the complications, the signs and symptoms of what women go through, do we have any support in Zambia for menopause clinics?
Okay, specifically as menopause clinics, we may not necessarily have them. But women who are having complications that are associated with menopause, we do attend to them in our gynecological clinics. Okay. So most hospitals, if not all, they tend to have a gynecologist. If the gynecologist is available, they have gynecological clinics, and in that gynecological clinic, women who have menopause with whatever symptom or complication that they may have associated with menopause, they can easily go to a gynecologist and they'll be attended to. Okay. So we do have those supportive clinics in terms of a gyne clinic where a woman can come and we may attend to them with whatever complications they have, which may be associated with menopause. Yes.
Oh, wow.
Yeah.
Yeah, this is nice. And those of you who've tuned in, this is Teledoctor Show. And if you want support, we have such services also as Teledoctor. If you know you're shying away from going to the hospital, you can still download our app or call our customer service line, and we'll be there to guide you through this period of menopause that you're going through. And we can even give you, if depending on the signs and symptoms that you have, is it a psychologist that you need for that major breakdown that you're having? We offer that here at Teledoctor. So, you know, there's one tradition that I always love where we talk about the quiz, true or false. And even you, the listeners and viewers out there, you love this part of the show because I see some of you also commenting true, false, and some of you have been jotting down in your journals. So we'll take a quick break and then we'll be back with the quiz. Welcome back. So before the break, we said we're going to have our short quiz, and please get your notepad and your pen, write down your answers if you've learned something about menopause today. And remember, it's a live and a phone-in program. The number is displayed on the screen if you need to ask us something about menopause, and we'll gladly attend to you. So Dr. Msoni, are you ready for the exam?
Yes, please bring it on.
All right. So the first question I have about menopause is that it only happens after 40 years. Is it true or false?
Okay, so that is not true, so it's false. The reason is menopause can occur before 40 years. So there could be surgical induced menopause, for example, where a woman undergoes surgery, what we call oophorectomy, where the ovaries are removed. Or other women could have undergone therapy, either radiotherapy or chemotherapy, that would have degenerated the ovaries, and then they'll end up going into menopause, which is induced. So it can occur before 40 years because of some of those reasons.
Thank you. Okay. At least I didn't know that one. I got it wrong. And then the other one is women lose their sexual feelings after menopause. Is this true or false? Okay, so what menopause generally does, like I mentioned initially, with the reduction in those hormones, there tend to be complications such as vaginal atrophy, there are mood swings, and with that, a woman may not, with vaginal atrophy, for example, I mentioned initially that they'll have painful intercourse, for example. Yes. So they may not naturally lose their sexual desire, so to say, but because of these instances that are happening, they may end up seem as if they're not interested. But like I mentioned, there are remedies to that. For example, there are vaginal creams that can assist with painful sexual intercourse. If a woman needs psychological support, they may need also to be supported in that effect, so that this woman maintains their sex life even through menopause. Yes. So this is false, right? It is false indeed. Not everyone also experiences it. No. Okay, I've gotten this one correct. Okay. And then the other myth is menopause symptoms do not require treatment. I think I think that's obviously false. I think part of our discussion that we had was so women who do present with severe symptoms, they will need treatment for that. So they do need treatment either in terms of hormonal replacement therapy or psychological support or other forms of treatments that with this woman can be given. So that one is also false. Yes. Last but not the least, the myth is menopause causes female cancers. True or false? Again, we partly answered that one, so that is basically also not true. Like I mentioned initially, so the cancers may be age-related than they are more related to menopause. Yes, so I think
That one is also false because it does not necessarily cause cancer, but age comes with a risk factor of breast cancer, ovarian, endometrial cancer, and the like.
Okay.
Yes.
So all the answers were false for the questions. If you wrote one true there, then you need to replay this clip on the Facebook page of Diamond TV Online or the Teledoctor Zambia Facebook page. Dr. Msoni, the last question that I had was, we talked about treatment of using pharmacological aspect. Is there any non-pharmacological remedies that people at home can try and use and all those things?
Okay, so there have been some plant extracts that have been noted to help with menopause. Though I must say, they may not naturally be encouraged because of we don't know their safety profile or the dosages in terms of how much we need to give. But they have been shown to relieve some signs and symptoms of menopause. So there are plant extracts from plants such as black cohosh. There's a plant called black cohosh. There are also plants such as red clover. Okay. There are also plants such as St. John worts. I don't know if you know.
St. John what?
It's called St. John wort. So it's amazing that. So there are a number of extracts for that are actually available in stores which sell natural remedies. Yes, so you'll find some extracts for these plants, and they've been shown to help with menopause. Yeah.
I was just trying to figure out if these black cohosh, red clover, if we can know them in our, Zambian setup, the languages,
Yeah, I wish I knew them in our local languages, but unfortunately I don't.
I feel our tribal cousins are going to name their children black cohosh very soon. I'm not going to mention them, but they would know themselves somewhere out there.
Yes.
Yeah. And what are your final words for this topic, the menopause? What is it that you can want the viewers out there to really learn more about?
Okay, so what I would say to the viewers is that menopause is a natural occurring process that occurs in women as they age. So with that comes certain symptoms that are associated with menopause. I would encourage women to be more open in their transitioning from productive age to menopause age, so that they can seek help. Like I mentioned earlier, help is there in our gynae clinics, help is there at Teledoctor.
Yeah.
I think they offer a platform with a gynecologist here that can be helped. So if a woman feels that the symptoms are severe enough that they need to be assisted, please feel free to attend to any gynae clinic, present your symptoms there. Feel free to contact platforms like Teledoctor. They'll be there to assist you with your problems. I think that's basically what I can tell the viewers.
Wow, and thank you very much for that wonderful topic that you've broken down for us, and it was amazing having you on the show.
The pleasure is all mine. Thank you.
Thank you. And time flies when you're having fun. It's something that was a very insightful topic that we had today. And I'm sure the guys out there, the ladies, the men, women, and everyone who was watching, you've learned something and you're going to pass this information on to somebody. So I'm going to tell you the clinics that we have as Teledoctor. All right, so we have the home doctor service that we give out as Teledoctor. So it's when we say a home doctor service, we're not just talking about the physicians. There are other nurses, physiotherapists, pharmacists who can come at the comfort of your own home. So do call us on our Teledoctor customer service line and we can get to give you that care. Then we also have the dermatology clinic. If anything is affecting your skin, the acne, eczema, pimples and everything, we have our partnering clinics. That's Tria Mwenechaya in Ibex, Woodland Specialist Clinic, and Abacus along Kafiwe Road. We also have a men's clinic every Saturday through our partnering clinics. Please, men, just go there. You've learned today that you can also go through andropause, right? Yeah, we also have an hypertension and diabetic clinic that we always have. And down there, we're able to show you which insurance company that we cover in our partnering clinics. We also love our babies, so we have pediatric clinics that we have. Bring your child for we have to monitor them. How are they growing? Have they attained their milestones and all that? So just bring them to every pediatric clinic at Chanya in Ibex, Woodland Specialist Clinic, and Abacus. We also have a neurology clinic. If you have anything that is affecting your head, your brain, just come through to the neurology clinic, and then you'll be seen by a neurologist. We also have an orthopedic clinic. You heard in our signs and symptoms. There are people who get complications when they reach menopause. It's important to check yourself for the orthopedic clinic so that you can also be assessed. We also have a fertility clinic. Those of you who have painful menses and you want to conceive, please come through to our partnering clinics and we'll be able to guide you throughout the journey. And if you have not yet downloaded the app, please, you can download it on Google Play Store or iOS if you are using an Apple phone, and we'll be able to share. The QR codes are there. Just scan and then you can input your details and you're as good to go. It's just as good as having the doctor from the palm of your hand. This has been the Teledoctor Show. We've had fun. We've learnt about menopause today. If you didn't watch us today, please do catch us tomorrow, 9 to 10 hours on Radio Phoenix, and we'll be live with the same topic. I've been your host today. My name is Malango Goma, and we are now officially parting ways with you. Until next time, it's bye-bye.